Here's a great idea for the next Indiana Jones movie that could also help save your life. Indy is barreling through India, fighting his way from Calcutta to New Delhi, and fending off poachers and thieves who are trying to rob him of a valuable golden powder that is reputed to have ancient healing powers. Our hero manages to stash his treasure in an ancient recess deep in the Taj Mahal, only to have it discovered by tourists who think it's powdered gold. After convincing them that the satchel contains poor man's saffron, Indy delivers his treasure to a local medicine man who uses it to cure an entire village. Seem far-fetched? Perhaps, but only to the Indiana Jones part. It turns out that there actually is a golden spice that used to be considered a less expensive version of saffron, but is now heralded as Indian gold due to its amazing proven healing powers for conditions such as arthritis, Alzheimer's disease, and possibly even cancer. The herb turmeric is related to another health-enhancing spice, ginger. Ginger has a long culinary history and can be traced as far back as 1280, when Marco Polo saw it in China and compared it, at least in color, to saffron. However, turmeric is commonly associated with India, where it flavors nearly every Indian dish. Curcuma longa is the most common type of turmeric grown in India. It is used in curries, prepared mustard, and even as a food preservative. Like saffron, turmeric has a distinctive yellow color, but unlike saffron, turmeric has powerful healing properties thanks to the power of curcumin. Curcumin is an antioxidant, anti-inflammatory compound found in turmeric and is responsible for the lauded medicinal virtue of the spice. In fact, curcumin has been attributed to healing a wide variety of health conditions ranging from cancer and pain relief to Alzheimer's. But do the studies back up the claims? Well, let's take a look. Curcumin is widely accepted as a potent anti-inflammatory. In fact, one review of curcumin studies found that it is not only safe and non-toxic, but also very effective at reducing inflammation. Researchers also found that curcumin works by inhibiting several different molecules that are involved in inflammation, including lipooxygenase, COX2, leukotrienes, prostaglandins, nitric oxide, interferon-inducible protein, tumor necrosis factor TNF, and interleukin-12. Sure, now that's a long and impressive list, but what does it mean exactly? It means curcumin reduces inflammation. But how well does it do it? According to a gold standard study, well, it does it pretty darn well. In a double-blind, placebo-controlled study, 45 post-surgery patients between the ages of 15 and 68 were divided into 3 groups. 3 times a day for 6 days, the first group took 400 milligrams of curcumin. The second group took 100 milligrams of phenylbutazone, and the third group got a placebo. At the end of 6 days, those taking curcumin and the phenylbutazone enjoyed a significantly better anti-inflammatory response than the placebo group. Or to put it simply, the spice worked as well as the drug, but without the nasty side effects. You gotta love that. As the study above shows, one obvious benefit of reducing inflammation is pain relief. And this is proven again in another double-blind crossover study. This time, rheumatoid arthritis patients were given either 1,200 milligrams of curcumin or 300 milligrams of phenylbutazone, the same NSAID as the earlier study, every day. At the end of the study period, both groups had significant improvements in morning stiffness, walking time, and joint swelling. And, once again, the curcumin was well tolerated and showed no adverse side effects. We get it. Curcumin reduces inflammation and eases pain equally as well as a common prescription drug. But what does this have to do with Alzheimer's disease? Well, funny you should ask. In 2008, researchers hypothesized that inflammation may play a role in Alzheimer's disease. Therefore, it stood to reason that anti-inflammatory NSAIDs should help in the prevention or treatment of the disease. To test this theory, they developed the Alzheimer's Disease Anti-Inflammatory Prevention Trial, or ADAPT. More than 2,500 patients enrolled in this randomized placebo-controlled study. They were divided into 3 groups, with the first group receiving 200 milligrams of celecoxib, The second group received 220 milligrams of naproxen twice a day, and the third group received a placebo. The study was to last for 7 years, but only 4 years after it began, the researchers terminated the study due to safety concerns related to naproxen. While they found that the NSAIDs did result to date in a 30% reduction in Alzheimer's among those patients taking them, they determined that the drug's side effects such as gastrointestinal bleeding and liver and kidney damage weren't worth the risk. Well, we agree. Given this, some clever researchers at UCLA were intrigued by the idea that anti-inflammatory drugs seem to reduce Alzheimer's disease. So, aiming to sidestep the dangers of NSAIDs, they decided to see if a natural anti-inflammatory could produce the same result. Re-enter curcumin. Researchers tested both a low dose and a high dose of curcumin on mice with Alzheimer's, like pathology, to see if the spice would reduce inflammation, oxidative damage, and plaque pathology. They determined that curcumin significantly lowered several inflammation markers, in addition to reducing plaque on the brain, which is a sign of Alzheimer's, by 43 to 50%. They concluded that curcumin shows promise for the prevention of Alzheimer's disease. Well, we think it does too, and without the dangerous side effects of NSAIDs. However, what we'd really like to see is a gold standard human study that tests the effects of curcumin on Alzheimer's disease. But this is a good start. Staying on the inflammation disease train, researchers have also wondered if curcumin could be effective in preventing yet another inflammation-related disease, cancer. According to an extensive literature review conducted by researchers at the esteemed MD Anderson Cancer Center in Houston, Texas, curcumin has enormous potential to prevent and treat cancer. Their review found that curcumin was able to suppress tumor formation, growth, and even metastasis. This is great. We love it when people do our work for us and review studies on our behalf, but it's not enough. We still want to look at some of those specific studies. Combined hormone therapy, containing both estrogen and progestin, sometimes referred to as MPA, has been shown to increase a woman's risk for breast cancer, among other things. In one animal study, researchers used this premise to determine whether curcumin could block the growth of induced MPA-accelerated tumors in rats. The rats were given a tumor induction on the first day of a 52-day trial. On day 30, the rats were given time-released pellets containing the estrogen-progestin combo. Researchers started their curcumin therapy in days 26 to 50. Now, researchers found that the curcumin delayed tumor growth, as well as other tissue changes normally seen in breast tissue exposed to hormone therapy. They concluded that curcumin should be tested in women already exposed to combined hormone therapy in an effort to decrease or delay the risk of breast cancer associated with combined HT. This is a very promising study, and we too would like to see the results from human trials. Now for the men. In a second animal study, researchers artificially induced prostate cancer in mice and then gave them either curcumin, chemotherapy, radiation, or a placebo treatment. They found that curcumin helped to control the progression of the cancer. Again, that's great news, but for mice. We'd like to see more human trials, though we understand that it's very difficult for researchers to find funding for gold standard studies on natural, untrademarkable substances, especially for cancer. Now, one of the easiest ways to enjoy all the therapeutic benefits of curcumin is to use turmeric in cooking. However, don't confuse turmeric with curry powder. While both are yellow spices often used in Indian cuisine, curry is actually a blend of spices, only one of which is turmeric. You want the straight stuff, just turmeric. Then you can go to town. Use it on any protein dish, fish, meat, or chicken. It also tastes fantastic mixed with lentils and garbanzo beans. But don't stop there. Add your turmeric to vegetables, rice, protein, and soups. Experiment and enjoy. The result will be delicious and healthy. If you're looking for a more concentrated health hit, you can also opt for curcumin supplements. The recommended dose is 450 to 600 milligrams per day. Just be sure to take it with a healthy fat such as coconut oil or olive oil to increase absorption.